Thank you, Anil. Ergonomics in operation theatre, we are all really interested in, and daily in and out, we go on improving some ergonomic part of the theatre. So, what is ergonomics was already defined is the science and design of the equipment, especially so as to reduce operator fatigue, discomfort, and injury. And this is the main aim of ergonomics is to reduce stress and to improve efficiency. It is the applied science of equipment design intended to maximize the productivity. Ergonomics has three main domains: physical ergonomics, which is concerned with the workplace ergonomics, which reduces work-related MSK disorders; cognitive ergonomics; and the organizational. This we will not be discussing. Of course, these are also very important: what time to schedule theatre, working time, staff management, staff rotation, etc., which also is very important for smooth running of the operation theatre. But we will be concentrating more on the physical ergonomics, which reduces fatigue to most of the operating room personnel. And measures for reducing fatigue, we keep on building up certain instruments which reduce the fatigue. Say for holding, you want to hold a thing for a long time, so you have a self-retaining clamps, etc., which reduces the fatigue rather than continuously holding with your hand. Small ergonomic innovations keep on happening in every theatre. Like in my theatre, a short-statured OT personnel used this method. So initially, she was not able to put up the bottle on the IV pole, so she just hanged a small IV pole and a small S hook to get that done every time. A pressurizer bag when the fluid needs pumping when there is hypotension is another way to reduce fatigue. A continuous holding of a reduction with a bone spike. Rather than that, if you use a clamp, that also reduces fatigue to the operating personnel. A large roll of Schmack bandage, rather than taking 2 or 3 of them when we want to exsanguinate extremity, use a larger roll, which is really very helpful to reduce this process and improve this process of exsanguination. Distractors in place also avoids fatigue of the operating surgeon, where you can, while operating on joints, reconstruction, articular reconstruction, orthodesis, I quite often use distractors to get the good field of joint. When we want to avoid lateralization of the portal, then rather than continuous pressure, you have certain instrument design, say a right angle which has a small curvature, keeps on pushing the reamer to the medial side. And this was devised by my OT personnel. He just cut it, the bone spike, and this part takes the reamer very well and it keeps on pushing, and this is how it works. So a lateralization of the portal is prevented by a simple device. Ergonomic design of various punches so that you reach the desired trajectory is another very useful part.
Sorry, sir, I can't see your screen. Is there a problem? Am I missing something, or is the screen not visible to you?
So rest of the person are able to see screen?
Yes, sir, you are visible.
Yes, we are able to see, sir.
I can see you, but
yeah, we are able to see the screen.
So you will have to just Nirbhay, just click the zoom panel, you will be able to see the thing. Okay. Click the zoom panel.
Yes.
Yeah.
Probably. Sorry
for that. Yeah. Thank you. While operating, we use various instruments which effectively do a good reduction, etc. And I'm very fond of dental reduction tool for getting those reductions, so that the depressed fragment can be held in position by your assistant very nicely with the use of ergonomic instrument. Ergonomic sideboard on the operating table, and these sideboards of various size, shape, length, breadth are really important. And I purchased one ebonite or backlight table sheet, which is 3x2, and then you can cut arm boards of your size and you can prepare arm boards of your size. Your C-arm also should be very good, so that in one go, in AP and lateral position can be adjusted very nicely. So look at the C-arm size, shape, etc. Certain machines provide that very beautifully. Operating rooms are stressful, complex situations in which there are ergonomic risk factors of lifting, shifting, and moving heavy equipment. And effortless shifting is so often required in theatre of the patient, so that the personnel do not avoid shifting. Everyone can join hand. So you can have shifting sling method, 1 or 2 towel method, rollers, or a shifting board. Ergonomic shifting is facilitated by certain things. Roll board, roller, so they can help you in various situations. For physical safety also in ergonomics in theatre, we improvise on certain things, and a suction mat when an orthoscopy is going on, or a simple suction disc will prevent the floor which is not quite wet and somebody would not trip onto the wet floor. Many times a cautery cord or a suction tip falls from the drape field, something like this, it falls down. So a simple anesthetic screen which is single hand I have converted into a trishul sort of thing. And then when you dip it down, the cartridge stays there. So a simple innovation would help that situation. For exsanguination, when we want a tourniquet for our surgeries, using a Rice Davis exsanguinator gives a bloodless film. Of course, you can always do with a schmuck bandage. However, this is a very comfortable thing with a Rice Davis exsanguinator. Many orthopedic patients would require positional comfort and have a lot of these jelly pads in theater so that the patients are comfortable. When an arm board sags down, what I'm trying to do is to give simple measures and tips about simple ergonomic measures which you can take in our theater. And arm boards many times just sag down. So having a small corner T attachment and then putting it into position would not let the arm board sag down. A small ergonomic change, friends, can go a long way. Patients are on the sideboard for a long time, and if their hands are in extension, they become painful, and then they keep on moving your the elbow during the surgery. So have just a flexion of the elbow, and they would be comfortable. Keep a sterile tourniquet, the all silicone bent one, and that would give you a wonderful surgical field for your good surgery. Always standardize the instrument layout on your trolley so that you save more time in picking up and searching the instrument. So when your regular assistant assists you, he gives you the instrument you want. But when the new one comes, so that legacy has to be transferred. And then if you keep the same profile, whatever is standardized for your theater, that is always good. Your discussion with co-surgeon, anesthetist team, and the procedure and the complexity of case would always make an operation very smooth when you discuss all these positions, whether you want to give a banana position for a PFN, or you want to give 15 degrees abduction for a DHS, or the choice of our table, whether you're going on a traction table or on a regular table, that all is important. Simple ergonomic measure like this is an ankle holder. So when you are repairing a patella, the assistant keeps on moving the knee, quite often goes on rotating the knee up internally, but a simple ankle holder would help that situation. Ergonomic instrument design, like a small sleeve where you want to have change the point of insertion of entry point, that also helps. Reducing, holding, and fixing the fractures reduces fatigue. So rather than continuous traction, a small, minimally invasive clamp would hold the reduction, and then you can be doing the surgery very well. Retractors are also really very good ergonomic things. So find out various retractors which are suitable for this situation. A good ergonomic design of implant also avoids patient discomfort. Like in PFN, many times this amount remains proud. So you can have changed the design of PFN for those short stretchered ladies, especially in Vidarbha region, where we need to do this. So this is the regular, and this one is a small truncated. You can use the attachment device there. Deep, very narrow right angle. So this is a right angle, very narrow retractor. So in a terrible triad, when you are fixing that coronoid fragment anteriorly, you have no space. So very thin right angle helps you a lot here, and that can be of various lengths. So they are a stack of 4, and they can be very nicely utilized there. An obtuse angle retractor. So usually we have right angle retractors, but in a deltopectoral approach, this obtuse angle helps a lot, where you want to just retract that fold of skin and you want to go onto the coracoid. Ergonomic aseptic syringe for irrigation, and irrigation is a quite often required thing in orthopedics. And if you do with a small syringe or a ear syringing bulb, that may not be adequate. Change to aseptic syringe helps a lot, and that is very useful. For improving hospital ergonomics and theater ergonomics and asepsis, a steam cleaning to remove debris is very good method. So this is a machine which cleans up the whole reamers, etc. And the use of compressed air also reduces your maintenance cost, and all moving chucks, etc. can be cleaned by the compressed air. Always think of infection control measures in theater. So anybody who joins from the theater from outside, all their keys, mobile phone, etc., are kept into the ultraviolet box. Keep a roll of all autoclave bandages, soft roll, etc. inside the theater, which are autoclaved, so that even if they emanate dust particles, they would be all autoclaved. Maintain your drives and devices very carefully, so that since the drilling is the core of our orthopedic instrument, and the driving systems are really very important to all of us. Pay attention to indexing and labeling. That helps a lot in really searching when you need the equipment. Proper labeling should be readable from 8 feet. That improves for the whole personnel. Anybody can pick up the thing. Proper spine positioners are really very important in our theater. So you can have good jelly pads, and spine surgery, you can have the flexion devices. You can position them. A flexing arm board is really very useful, so that you can position your limb in the position you want. And various positioners, a half round, or a IV hand raise or a big knee blocks, etc. In various sizes and type, they are very useful. A forearm hand raise while you are closing, and if the skin is getting a bit tighter, they reduce the venous edema and the closure becomes very helpful. So friends, make a list of Sunday tasks for maintenance so that hospital staff can execute them. They can make the proper tubings, etc. They can laminate them. Assess your readiness for emergency anaphylaxis and resuscitation. This is important part of managing your ergonomics. Human resources are really very important, and management of our OT time, management of our staff time. Here is the main role of hospital ergonomics, and pay attention to it, because the patient satisfaction depends on the core service we are providing, a good surgery, and various peripheral attributes. And if various peripheral attributes are good, the zone of tolerance for everyone improves. So friends, in the end, I would just like to summarize: make practical innovations, and every orthopedic surgeon goes on doing some practical innovation daily in the theater. Develop ideas that delight, generate your new ideas, turn your ideas into reality, fuse your imagination and planning, and act so that you get a ikigai feeling. Thank you very much for this patient listening.